Mrs. Smith. My name is Brittany. I'm going to be your nurse today. I'm going to start off by getting some vital signs on you. I'm going to check your temperature, and then I'm going to check your blood pressure. I'm going to check your pulse. I'm going to check your respirations. I'm going to check your bilateral breath sounds. And then I'm going to check your bowel sounds in all 4 quadrants. Make sure they're up and moving and active. I'm going to assess your pain level on a scale of 1 to 10, 10 being the worst pain. What's your pain level? If your pain's higher than about a 5 or a 6, and you want pain meds, I would try maybe some NSAIDs at first. Any hard pain medicine is going to cause constipation, and you really don't want constipation. And then I'm going to start off by assessing your breast. Are you noticing any soft or hardness to your breast? Is it hurtful? Is it warm? Are your nipples intact? We can give you some cream for that. We can even do cabbage to help with the swelling. I'm gonna palpate. And then next I'm going to go to your uterus. We're going to check your uterus. The fundus is firm. It's midline. It's about 1 finger length away from the umbilicus. And then when's the last time you've had a bowel movement? Really want to, if you feel like your bowels aren't moving, want to get you up and walking, see if we can get those going. We're going to check your bladder. When's the last time you voided? That we want to measure it and make sure you're actually going enough. And then we are going to check your lochia, see how much bleeding you're having. Check the pad, about a moderate amount. When's the last time you changed it? If it's been more than 1 hour, we'd cut it in half, or 3 if it's up to 3 hours. We'd want to know how frequently you're changing your pad. You want to know if there's any foul odor, signs of an infection. Then we'd want to check your perineum, which we'd have you turn over. And then we want to check to make sure that if she did rip, that we'd check for Rita. We'd want to make sure that there's no redness, edema, any ecchymosis, bruising of the skin down there. We'd want to check if there's any discharge, or if there is, in the approximation, make sure everything's healing up, nothing's getting bigger or reopening. And then we'd want to go up and check the epidural site. We definitely want to check our Rita again, make sure there's no redness, edema, ecchymosis, discharge in the approximation. Normally it's just a little teeny dot there. And then we'd have her turn back over. And the next thing we'd want to check is for DVTs, any type of surgery you want to worry about getting any blood clots. You'd want to check for warmness, redness, edema, if it's painful to the touch. We'd want to put SCDs on to help prevent blood clots. Even up and walking helps reduce your chance of blood clots. And then she had a C-section. We want to check the C-section line for the Rita again, any redness, edema, ecchymosis, discharge, and approximation. And we also want to check her IV site, make sure there's no redness, puffiness, that it's not painful to her, that medicine's actually going through it if need be. And then if she did have an epidural and needed a Foley catheter, that we want to make sure that the Foley catheter is being cleaned with the sage wipes, and that there's no risk for an infection, and that we're removing it as soon as possible.